Welcome back to Simply Women's Health with CeeJay. Today we're going to talk about menopause, the time in your life when your ovaries start to shut down and your estrogen starts to go away. This signals the end of your reproductive or childbearing years. For some women, it is bittersweet. I can't have any more babies. For some women, myself included, it was a blessed relief. No more menstrual cycles, no more cramps, no more worries about pregnancy. I considered it an absolutely magical time in my life. So in the United States, the average age of menopause is 51 years of age. Some women go through menopause very gently, have mild symptoms. Some women will have really, really severe, awful symptoms while they're going through their menopausal phase. And unfortunately, you can have perimenopausal or menopausal symptoms prior to the actual onset of menopause for up to 8 to 10 years prior to the end of your menstrual cycles. So how do you know that you might be going through perimenopause or menopause? Some of the classic symptoms. The first one, of course, is going to be menstrual irregularities. Your cycles will typically get shorter, they'll get lighter, and they will become less frequent. Now, if you are past the age of 35 and having heavier bleeding in between menstrual cycles, that's something you'd want to see your healthcare provider about. You might have hot flashes. You might have night sweats. You might have vaginal dryness. Because of the vaginal dryness, you may not feel like having intercourse, and that can lead to a low libido. You could have increased urinary tract infections. You could have increased vaginal infections. You may feel like you just don't sleep well at night, which can make you a lot more moody during the day. Again, these symptoms for some people can be very mild, and for some women it can be very, very life-altering. So how is menopause defined? Once you have gone 12 months without a menstrual cycle, in the absence of any other gynecological issues, you are considered menopausal. Do you need to have lab work? Not really. If you don't have a uterus and you do have ovaries, your provider can order some lab work to see if those ovaries have started to shut down. If you have had a hysterectomy or you've had your uterus removed and your ovaries have been removed, that's called surgical menopause, and something that your provider, in all likelihood, would have talked to you about before they did the surgery. So if you are still having menstrual cycles and you are having mood swings, lack of libido, you're having hot flashes, doing hormone levels really doesn't tell us anything. It just tells us that your ovaries are still working, and we already know that because you're having menstrual cycles. So your provider may want to check your thyroid level, but really doing hormones on a woman who's still menstruating doesn't really give us much information. So if you are becoming menopausal, what are some things you can do to optimize your health? First and foremost, I recommend to all my menstruating patients, get a menstrual tracker. The Flow app is a really good one, FLO app, and that will track your cycles and start to let you know when you are having irregular menstrual cycles. Regular screening exams, whether it be your mammogram, bone density, colonoscopy, whatever is indicated for you. I recommend that you keep your weight at a healthy level through diet and exercise. Weight-bearing exercise such as walking, anything that involves you moving your body, taking a calcium supplement. As you go through menopause and you lose estrogen, your bones can become weaker. So you want to do good bone health as well. Regular visits with your primary care provider to make sure that your blood pressure is stable and that you don't have any other concerns for cardiovascular disease. If you'd like more information regarding the different symptoms of menopause and things that you can do about them, I'm going to recommend that you check out my videos on vaginal dryness, hot flashes, treatments for menopausal symptoms. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CeeJay. I'm at your service.